Okay, so we've got our registration rims. They've been to the clinic, everything's been recorded, models have been placed in the rims, mounted on the articulator now. So we've got our condyle in-centric relation, setting the condylar angle to 30 degrees because we've got nothing, no recordings or anything else to go from. So we use the average. The information that we've recorded clinically, hopefully you've watched the clinical video, is now used to position the teeth. So we can see where the occlusal plane is going to be. So these are the essential 5 bits of information that need to be recorded. So you can see the occlusal plane, the lip support, as shown by the labial surface of the upper block. That's where we're going to put the labial surface of the upper anterior teeth. Obviously the midline, which has been scribed on, so we can use that to position the 2 centrals and work around from there. And then we've got the vertical dimension that's been established, so that's locked now into position, and we make sure that this pin here, the incisal pin on the articulator, stays at its 0 point. And then finally, of course, we've got the upper and lower related to each other in centric relation. So we're going to use that information to position our teeth, starting from the midline, working round to the canines, and then I'm going to position the lower anterior teeth. If you watched the other video that I've done on setting up teeth that I did some time ago, you'll see that I started at the midline, worked all the way around to the 6s, dropped down to the lower 6s and worked all the way forward. And I've done that for years, and then I watched Andrew Brook up at UCLan setting up teeth, where he sets the upper anteriors, sets the lower anteriors, and then positions the lower 6 in the correct position and works forward, and then finishes off with the upper 6s, which makes far more sense. I always set up like that now. So starting at the midline, round to the canines, really we're working to aesthetics and of course supporting the lip with the teeth. They provide the most of the support for the upper lip, and of course we want to keep on the occlusal plane. Now people do all sorts of things at this stage, which, well, not all sorts, a few variants that people do. We can just preserve the rims and keep them as a record, and if you're going to do that, then we can make a little silicone indices here and set up to the indices, or we can use a flat plane to set up, or we can just set up straight into the wax registration rims. I'm going to do that today. So we can remove these little locks that we've got, which locate the upper and lower models together, and I can make sure that the rims actually come apart. Wax them together a little bit for the registration, the articulation. So pop a knife in there, and now you can see we've got our upper and lower blocks occluding nicely at the occlusal plane. So when we're setting the teeth, then we're aiming to achieve several things. I'm just going to take the incisal pin out for the time being, just to make it clearer for you to see. You're best really to leave it in as much as possible, so you know you're not changing the vertical dimension. But it's worth just pointing out a few things. Obviously we're going to start here at the midline and work round. We're going to set our teeth such that the labial surface is flush here and the incisal edge is flushed here. The central incisor is going to go nice and vertical, so the long axis of the tooth is vertical. The lateral is going to go slightly off, so rotated round on this patient's left by a few degrees, so the long axis of the tooth is just off central like that, but you should see that the incisal edge will still be parallel to the occlusal plane but set up a little bit, and then the canine can go bolt upright with the cervical third of the tooth being very prominent and the incisal edge again at the occlusal plane. This is just sort of a bog standard setup really, so if we had photos to work to or some detail in the prescription, then we can work to those. Teeth come in different shapes and sizes. We've talked about that in a previous video, in the clinical videos, how to select those. This is the mould and shade that's been chosen for this particular case. So we can crack on and start setting some teeth. To note, when you take your teeth off the card, they're held onto the card with a little bit of gooey horrible wax. That wants removing, because when we come to carve the wax later. We want a nice hard wax, not this sticky, gooey, horrible stuff. And you'll also see when you look closely at the surface of the artificial tooth that it's almost got a glazed-like appearance. So as routine, we just, the motor's running backwards. As routine, we just take that off, just so that it's going to bond into the acrylic that little bit better when we come to process the denture. Okay, so overall, when we're positioning teeth in the anterior region, we're just following the block. When we come to setting the lower anteeth, we're going to want the lower anterior teeth sighting directly over the alveolar ridge, and then we're going to want to create the relation between the upper and lower incisal edges when we go into the protrusive excursion. We'll come to that a little later, but for this first tooth, we just want to, if I can find my knife, take a hot knife, and then we can just give it a wipe to make sure there's no horrible bits on it, and then we can start by just taking a section of the wax out and putting the tooth in that place. So cutting down the midline, cutting a chunk out the size of the anterior tooth, taking that out, and then we can soften the wax underneath. We've still got the wax adjacent to that area to use as our guide, and we can take our tooth, pop it into place, lining up the labial surface with the block and the incisal edge with the occlusal plane, like so. Position it in. We're not worried about getting the waxwork tidy around the tooth at this stage. In fact, it can hinder more than help at this stage if you've got too much wax, because it makes it difficult to move the teeth. So you can see I've got the long axis of the tooth pretty much vertical, maybe around a little bit more, with the incisal edge parallel to the occlusal plane and on the occlusal plane, and the neck of the tooth slightly in, so it's going to sit where the natural tooth was originally. So onto the lateral. You just again trim that. Next chunk of wax can be removed. I'm going to have to put the incisal pin back in when we start getting more teeth in here, otherwise we're going to lose our vertical dimension, but we're okay at the minute. Take a chunk of wax out, soften the wax underneath the tooth where the tooth is going to be placed. Take our tooth, position that such that it butts up to the central incisor, following the contour of the block around, and then we want the incisal edge just slightly higher than the occlusal plane. Again, you'd follow any instructions, but here just going for about 1 millimetre above the occlusal plane, with the long axis of the tooth rotated round, again cervical area of the tooth tipping towards the alveolar, keeping the incisal edge flush with the rim. And we're starting to work our way around the arch. I want to just check that we're following that arch form, so I just want to rotate mine very slightly until we've got something like this. Okay. And then onto the canine then. The canine's big chunky tooth. They should be bolt upright really in the mouth, nice and vertical. Prominent in the cervical area with the incisal edge of the tooth on the occlusal plane again, and following the arch around. So pop that chunk of wax out, soften underneath. Nice hot knife keep your knife reasonably clean as well. Wipe it on a bit of gauze or a tissue or something every now and again, just to get rid of any horrible bits of wax that may start to burn in the Bunsen flame. So putting it up to the lateral, want to be down to the, drop some wax on there, down to the occlusal plane again, like so. Very prominent here in the cervical region, and keeping the tip flush with the block. Okay, and it wants to be vertical. The long axis of the tooth wants to be vertical when you look from the front and from the side, and you almost want to be able to see the mesial aspect of the canine as well, like so, something like that. And then before we go any further, I'm just going to just make sure that these don't fall out, so I'm just going to get a hot knife and just run around each, not trying to do the gum work as such, but just making sure that they stay nice and secure while we do the remainders. As the wax contracts, sometimes you get small shifts in the position of the teeth and so on, but we can just give them a tweak as necessary as we carry on. So just around the backs of those teeth again, the palatal aspect, just make sure that they stay in, and then we can repeat for the upper right. Okay, so I'm going to do that and I'll show you when I'm done. Okay, so we've got those 6 anterior teeth in now. They're all positioned according to aesthetics, as we say. Now I'm going to start thinking about the lower anterior teeth. So we'll start positioning the anterior teeth next, where we need to consider the occlusion. So hopefully you'll watch the next video and we'll discuss that.